The research that I am a part of is very important because it narrows the gap between people who need help and the help that is available to them. It also brings to our attention where we're lacking. There are, I think, 2.5 million people in the state of Arkansas, and some of those people live in remote areas where they may be overlooked and they may not be aware or even able to articulate what their needs are. So that's where we kind of come in. We are able to connect with them and then use that data to kind of give their lives a story and say, hey, this is what is needed in this particular area.
Well, the first time I worked with Richard was probably about 3 years ago, and he was working with former professor Dr. Joseph Sue as a data management person, and he actually worked with us to help us build our surveys in RedCap. And so that's when I first knew about Richard's work, and he was just a pleasure to work with then. And when I found out that he was interested in coming to work with us on our Center for Research, Health, and Social Justice, I immediately kind of grabbed him up.
The Center for Research, Health, and Social Justice, we're kind of like the new kids on the block. We exist as an organization to kind of, as I said before, narrow the gap of the health disparities. We could always kind of anecdotally look at a situation and say, okay, well, here's a problem and here's how you fix it. But in the real world application, there has to be some data to support that. And that's where we come in. We kind of help gather that data, but we also focus on implementation. How does the data that we collect go into real world application?
Richard is not afraid of coming to me and say, hey, Dr. Fagan, I have an idea. Can we do this on the grant? Is it okay if we start this initiative on the grant? He's not afraid to share his ideas, and he just brings so much enthusiasm to the project. So we just enjoy him.
I think the most rewarding part of my job is simply knowing that everything that I do can have an effect on someone's life. Being part of the educational process for many Arkansans who are unaware of resources available to them or the help that's available or the risk that they face. So being able to bring all that into light and say, at the end of the day, I've done something that will make a difference in someone's life is definitely probably the most rewarding part of it.